Thank you, Keith. I really appreciate that. I'm delighted to speak to you today. So I think what will be best is I will do for 10 to 15 minutes, a PowerPoint presentation to try and cover this topic quite concisely, and then we can open up for discussion. So I will just share my screen and we can get started. Lovely. So slideshow from the beginning. Lovely. Okay, you can all see that?
Yep.
Excellent, thank you. So optimizing immunity and reducing the risk of COVID-19. And within that, I'll talk about the immunity plan book that I wrote and how that came about. So let's start just with I think a basic understanding really is that it seems quite clear. There's a lot of good evidence that really excess body fat itself results in immune dysregulation. In other words, the immune system is not going to function optimally, either in terms of its innate response to infections, but also in terms of the exaggerated response that we see with the acute respiratory distress syndrome, which unfortunately, has killed many, many people from COVID. Aging is also an issue when it comes to the immune system, and it's just a natural progression. As you get older, the immune system doesn't work as optimally as it does when you're much younger, and there are lots of different mechanisms for this as well. And as you're all probably aware, when you look at age is the biggest risk factor for death from COVID-19. If you're over 65, then the risk of death is 23-fold higher than people who are under 65 from COVID itself. But this is not by all means completely inevitable. People age differently. You can age in a healthy way, or you can age with multiple chronic conditions, which unfortunately has affected a significant proportion of the Western and even the developing countries now as well. So initial data came through. I started looking at this at the very beginning, just when initially, we'd seen data come through from China, data from Wuhan, data from Italy, and it was quite clear that the conditions associated with increased risk of death were all really linked to metabolic syndrome and poor metabolic health, which I'll come on to shortly. But essentially, if you look here, this particular, this data from New York reveals that 88% of people had at least one condition, more than one condition, the people that died from COVID-19. And looking at those, you look at high blood pressure, obesity, diabetes, both type 1 and type 2, morbid obesity, and coronary artery disease. Something similar as well from Louisiana. Again, very similar pattern emerging. From Wuhan, one of the earliest publications revealed that 60% of people that died from COVID in China had either type 2 diabetes or high blood pressure. In Italy, 99% of the people that died had at least one underlying condition, and that was on average about 2.7 conditions. The median number of conditions was 2.7. An average age of death was about 81 or 82. So the combination of age in particular with chronic disease was a big risk factor. How about diabetes? So, poor glucose control, again, a significant risk factor for death. And if you look at the data and literature in general around infections, any of the diabetes specialists here will know this, that if you have poor glucose control, then you are at much higher risk of complications from pretty much any infection, including chest infections. And even data from the UK revealed that type 2 diabetics who had poor control, certainly through primary care, were 6 times more likely to be admitted to hospital with chest infections and pneumonia than people that had much better control. Now, if you look at data on patients being admitted with type 2 diabetes, the ones that had poor glucose control had a 10-fold increased risk of death when they were admitted compared to the ones that had better glucose control. So if you break down all the various risk factors, with the data up to date so far, everybody's been talking about obesity, but obesity is only the tip of what I call the diet-related disease iceberg. So there's a 2-fold increased risk of death if you're obese, if your BMI is over 30, which actually is a very crude way, unfortunately, of looking at metabolic health, because it only looks at your weight in kilograms and you divide that by your height in meters squared. It does not take into consideration, this is particularly pertinent for the South Asian population, doesn't take into consideration ethnicity, muscle mass, and body fat percentage, and that's crucial. So if you look at metabolic syndrome, which I will define shortly, you've got almost a 5-fold increased risk of hospitalization and a 3.5 times risk of death if you have metabolic syndrome. So let's go into that a little bit further. This is a publication that I was first lead author on. It was published in the Journal of Physician, which is a journal that is owned by the British Association of Physicians of Indian Origin. We published this really to try and make sense of why is it that people from South Asian backgrounds and people from the BAME community were disproportionately affected by COVID-19. And it's very clear, in fact, there should be no confusion here at all. There should be none, okay? So when you correct for risk factors, there is no increased risk of death if you're Asian compared to a Caucasian. But when you look further at this, it's really, the underlying problem is metabolic health. So if you look at those 5 different parameters, which look at blood pressure being pre-hypertensive or hypertensive, having pre-diabetes or type 2, increased waist circumference. Now it's less for South Asians than for Caucasians before it becomes a marker of risk. And that's probably for genetic reasons. We seem to get these, people in the South Asian community seem to get conditions like type 2 diabetes and heart disease 5 to 10 years earlier than Caucasians. And it may well be that we are more vulnerable to these risk factors at lower levels of body fat, which, if that is true, and it does seem to be the case, very compelling case for that, then we should be even more careful in terms of the types of diet and lifestyle that we adopt. And of course, blood triglycerides and HDL. So what is metabolic syndrome? Well, any 3 of those being abnormal means that you've got metabolic syndrome, and that's the worst form of metabolic health. And actually, that's associated with the highest risk of all-cause mortality, heart attack, stroke over a 10-year period. And what's interesting is if you look on the right-hand side of this slide, when you break down actually in terms of metabolic health, first and foremost, there's only 1 in 8 Americans have optimal metabolic health. And that includes only 1 in 4 people aged between 20 and 40. So it's a real problem. I mean, the baseline health of Americans and probably very similar in the UK. We don't have specific data in the UK, but it's probably quite similar given our obesity levels. And in developing countries such as India now as well, is dire. So if you look at, if you look in the United States, 43.6% of normal BMI, wait for this, normal BMI South Asians had poor metabolic health. So this is not about obesity, this is about metabolic health, and it starts even with people who may be given the illusion of protection that they've got a healthy weight. There is no such thing as a healthy weight. It's complete and total unscientific nonsense, and no one should be talking about this. It's rubbish. And actually, there's a huge racial discrimination, if you like, by using BMI specifically as well, because it still affects Caucasians. About 20% of Caucasians with a normal BMI will have poor metabolic health, but it's much higher for South Asians to have these problems. The other thing we also talked about was vitamin D, and it's now emerged that severe vitamin D deficiency is associated with a 15-fold increased risk of death from COVID-19. Now, data has emerged since I wrote the book that actually reveals that it's also likely that vitamin D protects from infection, not just in terms of mortality, in terms of severe illness, but protects from infection. And we've got at least 1 randomized trial in Spain that shows that giving vitamin D on people admitted to hospital who were deficient had significant reductions in mortality. So this is a big issue. Vitamin D has a huge role to play in the immune system. It's something we've kind of ignored or forgotten. But I think what's more concerning, if you go back to 2012, cross-sectional data in primary care in the UK reveals that the overwhelming majority of South Asians in Britain are either deficient or severely deficient in vitamin D. And I suspect this still remains the case, and it's probably a huge factor that explains as well as a poor metabolic health, a disproportionate, death rates in people from South Asian backgrounds. And what's so sad is something very cheap, very easily, that can be rectified and hasn't been, unfortunately. Just a bigger picture issue here beyond just COVID. Thinking forward, really the root of many of these chronic diseases now is basically excess body fat because of it. That it drives insulin resistance and chronic inflammation. And it's not just about heart disease, it's likely implicated, as a causal factor in cancer, in Alzheimer's disease as well. Something very simple and easy that everybody can do at home. If you can't get all these metabolic health markers done, which you obviously can't without seeing really your doctor, although they're quite cheap and simple blood tests and blood pressure measurements, you can look at your waist to height ratio. So in essence, you want your waist circumference to be less than half of your height. And if it is, there's a good chance that you have certainly unlikely to have metabolic syndrome and likely are on the spectrum closer to having optimal metabolic health. So I was getting quite frustrated looking at a lot of this data. And then I wrote, I as an activist, as a campaigner, part of what I do is to try and get the message out there to influence health policy through articles, through mainstream media, through speaking with politicians and policymakers, and also as my role as a trustee for the King's Fund as an independent health think tank. So I wrote this article for European Scientists, which broke their record because got a lot of interest. And this is interestingly, this was just after Boris Johnson had been admitted to hospital and actually come out of hospital. And I wrote the article saying that, in this country, we talked about, the messaging being very clear about, stay at home, protect the NHS and save lives. But what was missing, the elephant in the room, is that it was clear that the metabolic health was the major sort of extra risk factor beyond age for COVID-19 deaths, and that it can be rapidly improved. So we have some clinical trials that show that within 21 to 28 days, you can reverse metabolic syndrome just from dietary changes. So I talked about this in the article. I also mentioned the fact that it was likely that the Prime Minister got particularly sick because of his weight, and that's why he was that's why he was admitted to hospital. And then subsequently, several weeks later, I wrote an article which featured on the front page of the Daily Telegraph, again talking about the fact that this is related to, if you go further back upstream from the metabolic syndrome, what's driving this really? Ultra processed foods, and actually it also increases chronic inflammation. And this quote, which is there, which was given to me by Professor Robert Lustig, pediatric endocrinologist in University of California, San Francisco, was that ultra-processed food sets you up for inflammation that COVID-19 will exploit. I was asked to go on BBC News and Good Morning Britain, and I talked about this elephant in the room. Finally, although I'd wish that this had happened much earlier on, this is actually, towards the end of the first lockdown. The data had emerged, even stronger data then, linking obesity and poor metabolic health with poor outcomes. And I again mentioned this time that, it was likely the Prime Minister was adversely affected. And it's interesting, no one else had mentioned it. No one in Public Health England, nobody, certainly in mainstream media, had mentioned that the link between Boris's weight and his poor outcome. And then it became a big story the next day, that this is what happened because of my comments. Interestingly, I said as an observation as a doctor, this isn't about fat shaming. This was actually the Prime Minister probably got sick because of this reason. And we really need to do something about this on a national scale, on a policy-making scale, because we have ignored this. We have ignored tackling obesity with policy changes that are likely to be effective for many, many years because of many barriers, including, the food industry, who's there to make profit, who influence politicians, who deflect blame to physical activity, etc. But I was pleasantly surprised. Matt Hancock contacted me not long after this initially and asked me to give him advice linking obesity with COVID-19. I explained to him what I've told you already, that it was about metabolic health. The reason why South Asians were adversely affected was probably because of those reasons, as well as vitamin D deficiency. And I was pleasantly surprised to see only a few weeks later, Matt Hancock did reply and said that he was copying his special advisors and he was going to take my advice on board. And then Boris Johnson did come out saying that he's going to do something. He actually admitted himself, which was interesting, finally, that he felt also that was the reason that he got particularly ill. He's been public before about his weight. I've worked and known allies of Boris who've mentioned the fact that he was, he knows that he's obese and he's had a bad diet for a long time. So this is not something that I was coming at, with no knowledge at all about his background and his lifestyle. Anyway, then my publisher wrote, asked me, can you write a book quickly, get this out, to explain to people the science behind immune health and metabolic health and the link between them, but also what people can do, give them a plan, something that can be done when it links to, about moderate exercise, reducing stress, and of course, changing diet. And that has a rapid impact on many of my patients. And there are some good studies showing that, you can reverse metabolic syndrome very quickly. It got very good reviews. I was pleased about that. But I think the key message as well towards the end of the book, which was there for Matt Hancock, is if we're really going to combat this obesity epidemic and chronic disease pandemic and type 2 diabetes, we need policy changes. We need to think about how we tackled smoking prevalence and through regulations address the availability, the affordability, and the acceptability of cigarettes. We apply the same to ultra-processed foods, which is now more than half of the British diet, and will have a big impact. And just to put things in perspective again, now globally, poor diet is responsible for more disease and death than physical inactivity, smoking, and alcohol combined. That's how bad it is. This should be front and center of the conversation when it comes to public health and improving people's health. This is affecting people in India, in many developing countries, in the United States, in the UK. More than half of what we eat now is shocking, is ultra-processed food. This is not just your simple junk food. This is not your McDonald's, your Burger King. This is packaged food. This is your bread, your brown bread that you get in the supermarket is ultra-processed, toxic junk. People should not be eating this stuff. It's very, it's basically what I tell my patients. If it comes out of a packet, has 5 or more ingredients, usually with additives and preservatives, it's ultra processed, and avoid it. Very quickly, I have some data with my, anecdotal data with my own patients, and I've written about this, but there's a GP, a pioneering GP in Southport called Dr. David Unwin, who's done great work actually with patients with type 2 diabetes, and shown almost 50% of his patients, just from adopting a low refined carbohydrate diet without counting calories, have sent their type 2 diabetes into remission. And this, this data is even going over several years now, which shows that it, it can work long term, and it's quite extraordinary. But it's not just about sending type 2 diabetes into remission and people reducing their need for medications. All the markers of metabolic syndrome also seem to improve. The blood pressure improves, the waist circumference comes down, triglycerides comes down, HDL goes up. This is something I wrote a few years ago also, just to reiterate that the dietary changes, not just independent of weight loss, will improve outcomes within a few months. We don't have lots of trials, but the trials we have are pretty compelling and convincing. And of course, we have biological studies showing that certain types of food have anti-inflammatory benefits as well. And more recently, I was co-author on this publication, really taking the science a little bit further. I think what many people don't realize, what many diabetologists don't realize, that high insulin, chronically high insulin over a period of time is probably what's driving a lot of this problem. High insulin is prothrombotic. So in layman's terms, it increases clotting. It is pro-inflammatory, and it can precede the development of type 2 diabetes by at least 2 decades. So many people are going around, because it's not something we measure routinely, and I don't think you really need to measure it. I'm not, advocating for expensive tests and everyone should get their insulin measured. Fasting insulin measured, but you can look at those markers of metabolic health, and that will give you a guide to whether you've got chronic hyperinsulinemia, even if you're not type 2 diabetic. We know that 2/3 of people who have MIs, heart attacks, now have metabolic syndrome. So chronically high insulin is probably at the root of this problem, and we should think about all the different measures we can do from lifestyle to reduce insulin. Just very briefly, if you look at type 1 diabetes, of course, the main focus has been controlling blood glucose to prevent macrovascular and microvascular complications. But of course, for type 1s, they can't survive without exogenous insulin. But type 1 diabetics still have an average life expectancy of less than 10 years compared to normal people who are not diabetic. The question is why? If their blood glucose is well controlled, why is their life expectancy still significantly reduced? I think my hypothesis is probably because of exogenous insulin. So the question is not about removing insulin. It's about, can we give dietary advice to type 1 diabetics that reduces the amount of insulin they require? And that, again, is going to come through reducing high glycemic carbohydrates in the diet. So to conclude, poor metabolic health is poor immune health. I think we need to understand that and accept that. Obesity is only the tip of a diet-related disease iceberg. And I say this, and there's been a bit of a reaction on Twitter when I put this recently. A lot of people coming in support, some doctors saying go back to medical school. But I think this is just lack of knowledge. They don't really understand what's going on here. COVID-19 is a diet-related, and in loose terms, if you like, disease. The complications, the poor outcomes are related to poor diet. That, in my view, is unequivocal. Metabolic health, the good news is we can rapidly improve this, with dietary changes, usually within 21 days. And ultimately, I've been banging on about this for a long time. Keith knows this for many, many years. If we're going to fix healthcare, we're going to need to fix the food. Thank you.